So again, please press continue on the Zoom application to stay in the meeting. At the beginning of the meeting, all attendees will be muted and will remain muted until the question and answer period. After the presentation has concluded, there will be a question and answer period. And so we ask that you submit your questions either by raising your hand on the Zoom feature or typing the question in the Q&A box at the bottom of your screen. You may, if you're joining us by phone, you may raise your hand by pressing *9. And we ask that you keep your questions as specific as possible and relevant to the topic. Note that we will only be responding to relevant questions. And we ask that you be mindful of time and speak for no more than 2 minutes. This may be adjusted based on the number of questions that we receive. Staff will enable speaking at the appropriate time. And lastly, the meeting will end promptly at 12 p.m. For any additional comments or questions, please visit the Smoke Free Santa Clara webpage. And now we will begin our presentation. So Leslie, you will share your screen for the slides. Thank you. And we can advance the slide. Thank you. And so for general introductions, is good. The next slide, thank you. And so again, I'm Jennifer Acuna. I'm a management analyst with the City of Santa Clara, and I want to welcome all of you to our meeting today. Joining me from the County of Santa Clara is Leslie Sellers, consultant with the County of Santa Clara, Jennifer Aguilar and Dawn Tran with the Tobacco Free Communities program. So thank you for joining. Thank you. So tobacco remains the #1 preventable cause of death and disease in California. The Santa Clara's County Healthy Cities program seeks to address tobacco-related health concerns by promoting policies and practices to provide tobacco-free and smoke-free communities. Currently, the city has adopted 6 out of 12 recommended tobacco prevention strategies in the Healthy Cities program, which are focused on reducing exposure to secondhand smoke. Although the city prohibits smoking in multi-unit residences and many outdoor areas, it does not prohibit the sale of flavored tobacco products or require a local tobacco retailer permit. The county has provided funding to cities to support tobacco prevention strategies known to have the highest impact on reducing tobacco-related disparities and inequities. Next slide, please. And as such, the city is pursuing tobacco policies. And so by way of background, on April 7th, 2020, Council authorized the city manager to negotiate and execute a grant agreement with the Santa Clara County Public Health Department to explore tobacco prevention policies that have been shown to reduce youth access and exposure to tobacco products. The city executed the grant agreement on July 20th, 2020, in the amount of $48,944 for the current fiscal year of 2020-2021. And now I will pass it on to my colleague, Leslie Sellers, who will continue with the presentation. Thank you.
Good morning. Thanks, Jennifer. Thank you to everyone for joining us. I'm going to be giving you an overview of the policies that are being considered by the City of Santa Clara so that you'll have some information about the policies that the city is considering, and any comments or questions that you want to make, we'd be happy to take at the end. Some basic information about smoking. There continue to be 1 in 8 deaths in Santa Clara County that are due to smoking. And data shows that 1 in 10 Santa Clara youth are using tobacco, including e-cigarettes. In recent years, there's an epidemic of e-cigarette use as use of traditional cigarettes is declining among youth. There was a 78% increase in high school use between 2017 and 2018, and 1 in 3 Santa Clara County teens report trying e-cigarettes. To give you some background about existing laws, there is a federal law that prohibits the sale of candy and fruit-flavored cigarettes, but that law does not apply to menthol, so menthol cigarettes are still on the market, and it also doesn't apply to any flavored tobacco products such as cigars or little cigars. You see these as like Swisher Sweets, smokeless tobacco, hookah, and any of the electronic smoking devices or e-liquid that's flavored that are used in these devices. And I'll give you some examples in just a minute. California last year, the state legislature passed a law that would prohibit the sale of most flavored tobacco products. Unfortunately, that law is not yet in effect. The tobacco industry filed a referendum that will be on the ballot in the general election in November 2022. So the law is on hold until then. The state law does allow for local governments to adopt stricter local laws, which is what the city of Santa Clara is considering doing. These are the policy options that are being considered by the city and for which we're seeking your input. The overall goal is to reduce youth access to tobacco, and the main strategies are to prohibit the sale of all flavored tobacco products, prohibit the sale of all electronic smoking devices, and reduce the availability of tobacco by limiting new retailers within a certain distance from schools and from other retailers, and prohibiting the sale of tobacco products in pharmacies. A little bit more about flavored tobacco use. We know from research that 80% of youth who've ever used tobacco started with a flavored tobacco product. And when asked about it, youth believe that flavored tobacco products are safer and less addictive than other tobacco products that are tobacco flavored or unflavored. The policies that the city of Santa Clara is considering would be a comprehensive flavor ban. That means it would prohibit the sale of menthol cigarettes, and it would apply to all tobacco retailers in the city of Santa Clara. There are approximately 65 tobacco retailers right now. There are 7 other laws in Santa Clara County, 6 cities that have adopted a flavored tobacco ban, and the unincorporated area of Santa Clara County have also adopted this law. To give you some examples of the kinds of products that we're talking about, here are menthol cigarettes. Those are pretty commonly seen, usually in a green box. Newports and Cool are common brands. Here's an example of little cigars. Swisher Sweets is a brand I've mentioned that you would see frequently. You can see the flavors on these: tropical fruit, tropical fusion, strawberry, pineapple, grape. Smokeless tobacco also comes in different flavors. Here's examples of cherry and berry flavored smokeless tobacco. And e-cigarette products, we've seen a real growth in the e-cigarette market in the past few years. There are a variety of different devices here. Some of them are what's in the box kind of to the left, large size tank devices, and some are smaller rechargeable e-cigarettes. Juul is a brand that you've probably seen a lot of, that has specific pods with nicotine solution that goes into the e-cigarette that can be vaped. Many of these e-cigarettes have refillable cartridges that you can refill liquid, and the e-liquid comes in more than 10,000 different flavors. Here's an example of a brand that's specifically aligning its products with candy and making the imagery look similar to other candy products on the market. The FDA and the FTC have taken notice of some of these practices, although they don't have the resources to go after all of them. Here's an example of a company they issued a warning letter to. The product on the right is actual apple juice, treetop apple juice, and then the product on the left is actually e-juice for an e-cigarette, but the imagery on the packaging is meant to simulate what's on the apple juice, so it looks similar. Another policy being considered by the city of Santa Clara is to prohibit the sale of all e-cigarettes, electronic smoking devices, and vaping products. As we saw on the prior slide, there are a variety of different electronic smoking devices on the market. There are 7 laws similar to flavored tobacco in Santa Clara County, including 6 cities and the unincorporated area of Santa Clara County. In terms of e-cigarettes, the Department of Public Health issued a health advisory on the use of e-cigarettes prior to COVID, encouraging people to stop vaping any product because of the health risks. And we've also seen that during the COVID pandemic, the symptoms of COVID are greater for people who smoke or vape, and they tend to have longer term hospital stays and increased health consequences. Most e-cigarettes do contain nicotine, which has been shown to be harmful to the developing brain, and there are a variety of other chemicals in liquid solution for e-cigarettes. 2 other strategies that are being considered by the city of Santa Clara. One would be to limit the location of new tobacco retailers. So if I wanted to open a new store to sell tobacco products, I would not be allowed to locate, say, within 1,000 feet of a school. That's currently the distance that the city is considering, or within 500 feet of another retailer. If I have an existing tobacco store, I would be able to continue selling products until I go out of business or sell the store to someone else. So it would only apply to new retailers. Another policy element is to prohibit the sale of tobacco sales in pharmacies. This is something that some pharmacies have already voluntarily started doing. The idea is that it's inconsistent, it sends a mixed message to consumers if you're going to a pharmacy to improve your health to also purchase a product that has negative health effects. There are 5 laws in Santa Clara County to prohibit the sale of pharmacies. And in the city of Santa Clara, there are approximately 7 retailers for which this would apply to. A few are supermarkets that have pharmacies in them. All of these policies would be incorporated into a tobacco retailer license. So right now, if I am selling tobacco products in the city of Santa Clara, I'm required to get a license from the state of California. This would be an additional requirement to get a license from the city. Generally, local governments create local licensing programs to adopt more comprehensive restrictions on tobacco products than are found in state law. Some of the examples we just mentioned, such as the prohibiting the sale of flavored tobacco products or e-cigarettes. And it allows for more meaningful penalties, such as a license suspension if a retailer is found violating these tobacco laws, such as selling tobacco products to minors. These products are self-funding. The licensing fee supports the cost of enforcement. The local retailers would be required to get a tobacco license every year, and a violation of any tobacco law would be a violation of the license and could potentially make them eligible for penalties such as license suspension. It's estimated that the fee would be around $425 to cover the administration and enforcement of the program. That's what's been charged in some other cities. The Santa Clara County Department of Environmental Health is willing to administer and implement the program if the city of Santa Clara adopts a tobacco retailer licensing program that's similar to the county's requirements. And that's where the $425 fee comes from. So we are very interested in getting your input. We're holding this public meeting. There's another public meeting next week, and there's also a survey available online. So if you haven't already participated, we encourage you to go to the survey. And there's also a website on the santaclaracounty.gov website where you could where you can receive more information about the policies that the city's considering and any additional information about when the council may be considering those policies. So I'm going to stop it there and maybe turn it over to Jennifer for a refresher on how you can ask questions, and we'd be happy to take your input.
Thank you, Leslie. And so as you can see on your screen, we have, if you would like to post a question, you may also, as I said at the beginning, is type in your question in the Q&A box at the bottom of your screen, or you may raise your hand on the Zoom feature. If you're joining us by phone, you may press *9 to raise your hand, and the last 4 numbers of your phone number will be called to ask a question. Once your number is called, please press *6 to unmute, again, if you are on the phone. So see that we have 3 hands up, and so I am going to, we have Mayra, you have a question? And I also, to let everybody know, I have we have Jen Aguilar and Don Tran also joining us from the county to answer questions. So Mayra, you should now be unmuted. You could.
Hello. Hello. Thank you. Hi, my name is Mayra, and I represent NATO, which is a National Association of Tobacco Outlets. When this notice got sent from San Jose and from Santa Clara on the survey and there being a future flavor ban, a lot of the retailers were super concerned, and they called me, and so that's why I'm on the line. Few things that we talked about is this is a youth epidemic. So meaning that there's a problem that youth are getting a hold of this product being under the age of 21. And the fact that this is happening and it's coming from different sources. So right now, the city of Santa Clara is looking at getting the retailers who are in the front line of asking ID, of having stores that do not even permit people under 21 to come into the stores, to give access only to adults. It's very difficult for youth to get these items from retailers. It's very difficult for the youth to they need to get education, and the city needs to come together with a solution that is not just banning something that is legal, heavy regulated. The retailers that I spoke to had a few comments. One is existing businesses should be, like you said, grandfather. Thank you very much for that. 1,000 feet from a school for new ones and 500 feet from other retailers is fine. They agree to that. They even said maybe the city should limit the amount of tobacco license and maybe leave the ones that are working and existing businesses fine, but not adding any more. The other one is that the kids are getting it from online. The kids are getting it not from the 7-Elevens. I went to one of the stores, it was called City Rocks. I really think that the city council should invest in actually going to the retail stores, because they had no 21 and over people allowed. They had a POS system that they have to scan your ID in order for them to be able to even sell you any product. Everything's behind the wall. On the counters. So what I'm saying is that there's other ways to not hurt these businesses. Most of the businesses I went to, 80% sell flavored tobacco for adults. Adults like flavored, like I like flavored alcohol. I like to do flavors. They are selling 80%. So if you do this, you're going to put many of the businesses, if not all, that don't have groceries out of business. So this is something that the city council needs to hear. And another thing is, we would love for the city council to actually reach out. I have a list of retailers to reach out to the retailers and find out. They don't feel supported. They feel like this is going to implement and during a pandemic, just put them out of business. So there's a lot more, and I'm being mindful for other retailers to get to speak. There's a lot more that I'm going to send an email. And if you want to contact me, I have a list of 38 retailers that definitely did not want to call because they're dealing with their businesses. So and they're afraid to talk. Some of them have an English barrier, and this is the only way that they can provide for their families. So I'm going to stop there. Thank you very much, and I'll be sending emails to give you guys information on how we can work together.
Thank you, Mayra. Leslie?
Thank you, Mayra. We will definitely take your comments. All of the comments provided at the meeting will be summarized and taken back to the City Council. In terms of data, I want to address a couple points. In terms of online sales, there are stricter laws now in California for youth who attempt to buy online. If the package is delivered to a house, someone over age 21 has to sign for it, and it's labeled as tobacco products. So there are efforts to reduce youth access over the internet. And there is data, particularly from Santa Clara County, that shows that half of the youth who are able to get cigarettes are able to purchase them in a store. And 1/3 of those are from about half of students reporting, let me restate this, about half of students reported buying e-cigarettes, and a third of them got them from a store and a third got them from someone else, and only 14% purchased from the internet. And 62% of those who purchased from a store were able to purchase it at a vape shop. So the council is also looking at the problem of youth who are able to access through stores that are technically adult only.
And Leslie, is there any way that all the retailers were saying, put those people out of business and get rid of their license and do, the sting operations? And they're saying that they're not actually seeing that because of the POS systems and because of how strict they are. But those are great points. Thank you.
Thank you. And so Mayra, I'm going to lower your hand so we can keep track of those who are still needing to speak. We have next Rima Khoury. So I am going to ask you to unmute, please, to speak.
Good morning. Thank you for holding this meeting. Again, my name is Rima Khoury. I'm one of the founding members of the National Hookah Community Association, which was established to protect and preserve the culture of hookah. Just to give you a little background, you know, the culture and tradition of hookah has been around for nearly 1,000 years. It's practiced by Middle Easterners, Turks, Armenians, Persians, and Indians. It's still very much that practice is alive today. You know, and you know, oftentimes it's a centerpiece for social gatherings and celebratory events. It's you know, often offered as a sign of hospitality or respect when people come to your home, as it was done, you know, hundreds of years ago by kings and sheiks. And, you know, because, you know, this cultural tradition that is practiced by a lot of minority communities and a lot of these people have small businesses, you know, who oftentimes don't speak English and don't have a voice really, or are afraid to step up because, you know, in their own home countries, you know, they would be persecuted. You know, we feel like we want to educate people on what hookah is and what it is not. It is not the problem that you're seeing with these high, you know, youth usage. We agree, and we are galvanized around the idea that kids should not be smoking, and we want to do our part to prevent youth access and usage. However, you know, because of the nature of hookah, you know, hookahs are 3 feet tall. They take 15 to 20 minutes to set up. There's 10 different components and parts. And, you know, oftentimes they cost upwards of $200, $400, $600 just to purchase, which is a high barrier to entry. These are not being used by kids. You don't see hookahs being confiscated in schools. It takes too long to set up and it's too cumbersome and large for kids to be smoking in the bathroom. Governor Gavin Newsom mentioned in his executive order address that hookah is just not the problem in classrooms. Senator Hill, the author of SB 793, which is the California state flavor ban, once he learned what hookah was about and its rich cultural tradition, he exempted hookah from SB 793, which, as it was mentioned, I think earlier by Leslie, is in a referendum right now. But, you know, the language in SB 793, which is that only, you know, hookah products can only be sold in 21 and over establishments, meaning, you know, not gas stations or grocery stores. They have to be licensed to sell and abide by all the laws, both local and state. And of course, you know, these were concessions that were made by all parties, but, you know, Senator Hill believed that, you know, we don't want to eliminate the rich cultural tradition when, to be honest, it's not the root of the issue. Nationally, the CDC had sent out statistics in 2019 that stated that hookah use amongst teens was one of the lowest at 3.4%, and it's even lower in California at 2%. So, you know, before this rich cultural tradition becomes collateral damage, you know, we ask first, you know, that our legislators please understand what hookah is and what it is not. It is not the problem. And we don't want it to turn into collateral damage and decimate this rich cultural tradition when it's not the issue. We obviously invite more regulations to limit youth access and usage, and we are 100% behind whatever that is. If that means heightened, you know, age verification, if it's a TRL, even reasonable zoning. You know, there is a way to balance the interest to prevent youth usage and access while also preserving the cultural tradition of hookah. And so my ask is that, you know, that when we go back and the city council considers all of this, that they please consider mirroring the language of SB 793 that has a hookah exemption. And please understand, you know, what this cultural tradition means to so many different minority communities and their businesses. And, you know, we want to work together, businesses want to work together with their lawmakers to achieve these regulatory goals. And there is a way to do that. You know, we're all in this together. You know, we're all struggling with COVID, you know, and we obviously want to do our part to help protect kids. But, you know, again, we don't want to solve a problem that isn't a problem. And I know that it might be easier to do broad sweeping flavor bans, but, you know, again, we don't want to have our culture diminished for reasons that are, you know, unsaid here. So thank you for your time. We really appreciate you guys listening. And obviously, you know, we are a resource, the national, you know, the Hookah Community Association is here as a resource for information. We did send emails to the city council with a lot of this information, but we certainly are available whenever you need info. Thank you.
Thank you. I really appreciate the input from everybody. And now we're going to go to our next participant who would like to speak, Rojas Communications Group. So you can unmute. I think we have someone on the phone. Let me just check back in with Rojas Communications Group. Did you still want to speak? I see that your hand is now lowered, so I will move on to the next. Oh, you do have your hand up. Okay, let me. So you should be allowed to unmute.
Yes.
Yes, we can hear you. And then we'll
Good morning. Thank you.
go on the phone. Thank you.
I first and foremost, I want to echo the thank you on behalf of the retailers. My name is Jaime Rojas with the National Association of Tobacco Outlets. It's been rare for us to be prior to City Council to give our input and possible solutions. So thank you, staff, for taking the time and submitting this to council when staff report is completed. The issue, as you all know, and as Leslie put up, that the issue was on illegal e-cigs and vape. As the numbers showed, about 2,200 deaths have been occurred, as the FDA has said, by illegal products on the black market on these type of products, which one was e-acetate and cannabis. None of it has been done and gone back to any of the other tobacco products. Currently, there's 328 million Americans in the United States. So 2,125 deaths is a really small number. Not to say that any death is good, but to call an epidemic in comparison to that number is not a reality. The current pandemic with almost 600 million Americans dead, that's an issue. And we want to focus on those two subjects, e-cigs and vape. Currently, we've seen that the all-time low of youth usage for traditional tobacco products like chew, premium cigars, combustible cigarettes, as menthol was mentioned here, are less than 3%. Chew, I think, is even less than 1%. That's been confirmed by the state, FDA, CDC. And in addition to that, I'm kind of embarrassed that tobacco control has only given the city, and you have to apply for it on your own sales tax dollars, $48,000. Tobacco control only for the state of California annually has a budget of $500 million. So now you have to beg for your own money coming from your city on these sales tax dollars. And the usage for those dollars should be used for a few things. We currently support a tobacco retail license, which I think should be done in all cities. Unfortunately, only 25% of those cities in the past 10 years in California have exercised their TRL. We're in full support of that because it does code enforcement and it also allows for education. But for $48,000, what can you really do? In addition to that, those dollars should be also used for grants that the city can provide to mom and pop businesses for point of sale systems. Why not? And none of these conversations do we bring in school districts to see what they're doing in regards to vape and e-cig education in middle school and high school. And the reason why not, because there isn't any. We keep asking city by city, school district by school district, what they do. At a maximum in a 4-year high school situation, students get approximately an hour and a half to 3 hours max in 4 years on tobacco in general. In most cases, none on e-cigarettes and vaping. We also ask that in addition to all this, that we appreciate you working with us and look at the opportunities to be able to see what works and what doesn't. We've done the numbers already with the cities of San Francisco, Oakland, San Leandro, Contra Costa County, just surrounding districts with flavor bans, even Santa Clara County. The numbers have not gone down on youth usage on vaping and e-cigarettes. The reason why, because there's no education coming from the school districts. The money is spent on tobacco kids-free videos showing kids smoking, which is illegal, and lobbying and giving money to nonprofit organizations to speak in city council meetings. It's unjust to use these tobacco dollars and public funding for just that and avoid not educating the youth, which is what the monies are for. So we asked to focus on e-cigs, vaping, not the issues of combustible cigarettes, premium cigars, hookah, and chew, which is less than 3% youth usage because education actually works. We appreciate this. We hope you continue working with us. And we hope that staff and council also come and visit the stores and actually see that the example of apple juice is something that's being sold online because most retailers have limited shelf space. So they're going to put products that sell for adults only. Thank you so much for your time.
Thank you. Thank you for your input. And I'm going to go to our Q&A box. We do have a question there. Do you recognize the difference between USB-sized vape and e-cigarettes and the 3-foot-long hookah you cannot hide in your pocket or backpack? You can't really move around with the water in the glass vase at the bottom and lit charcoal on top of it. Quotation mark, hookah is not the problem in the classroom, end of quotation, Governor Gavin Newsom. So thank you for those comments. And there is another question. Is there something the city can help multi-family units govern smoking inside units? Will the city help fine residents? The issue is proving they are smoking when residents deny smoking. However, neighbors are reporting smoking inside their units. And so regarding the smoking ordinance, I would certainly encourage folks to visit our webpage where we have outlined resources and also the requirements for multi-unit residents to enforce the ordinance and what the requirements are under that. For smoking complaints, you may also contact the city manager's office at 408-615-2210. And we're happy to take your information and make contact with the multi-unit residences. Additionally, as a resource, there is Project Sentinel, which is a nonprofit organization that the city works with, and they provide neighbor-to-neighbor, landlord-to-tenant dispute resolution services. So definitely encourage folks to reach out to them. I will put in their information on the chat box as well to help with neighbor-to-neighbor conversations and any dispute resolution. So thank you for that question. And I believe that we have a couple more hands up. Let me just check that I've addressed the Q&A that was already there. And so now we have Jay, you are up next. And you should be allowed to unmute yourself now. So you just unmute yourself, you should be able to speak.
Hello.
Yes, we can hear you.
Hey, good morning. How are you guys?
Good, thank you.
Okay, so this is Jay, and I'm one of the retail tobacco owner in city of Santa Clara. In response to your thoughts and upcoming ban on e and flavored cigarettes, I would like to focus on some of the technical things. The technical things which is you guys need to think about and consider for your ban. Every industry has a growth, cell phone, car, clothing, shoes, right? 10 years ago, we all were using the flip top open push button phone. Today, we are using all the Androids and iPhones, right? Same way, the combustible tobacco, cigarettes, and everything has been converted to e-cigarette now. 80% adult smokers are switched to e-cigarettes, and the flavor is one of their privilege. Like ABC, alcoholic and beverages, has tons of flavor, beers and drinks now, right? So the flavor tobacco and the e-cigarettes are their privilege now, and I would say option when they are buying either regular smoke or flavored smokes. And being a retail owner, I would like to say nobody sells to teenagers. We are highly responsible for that. And especially a father of two grown-up kids, both the kids studied a scholar in Santa Clara High and Wilcox High. One is studying at a School of Medicine right now, and the younger is going to UCs this year. In the entire life, even dad owned the tobacco shop, they never smoke, they never drink, or never drugs. My kids were reporting me that they were smelling all the marijuanas in the school, in the toilets and the restrooms. Can we stop that marijuana? No, right? So kids are getting anyway, anyhow, from adult smoking friend. And in fact, I have seen the parents are buying the tobaccos and flavored cigars and flavored cigarettes for them, e-juice for them. How we can stop that? Right? So the frustration is, I really appreciate and the efforts towards, and I don't encourage because my kids didn't smoke. Every kid is just like my kids, right? And I have to protect them. But the reality is parents are smoking in front of their kids. So kids are getting all this learned from their parents. There is not a responsible parents in the society. That's why we have a teenagers and the underage peoples are spoiled.
Jay, thank you. Thank you for your comment. I'm going to ask that you wrap up so we can allow time for other folks that also have questions. If you want to say your...
Okay, thank you.
Thank you. And we have, so I'm going to lower the hand. And next up we have George Jonson. And so you should be allowed to unmute yourself and speak.
Hello, guys. Can you hear me?
Yes, we can hear you.
My name is George Jonson. I manufacture traditional wooden hookah pipes, and I am a volunteer at the National Hookah Community Association. We are a grassroots organization that are included in protecting the traditional rights of hookah smokers. I want to make a few comments that we don't fully comprehend, like a lot of legislators don't fully comprehend that a flavor ban is a de facto ban on hookah because traditionally tobacco has always been preserved in honey and molasses. Shisha, or what they say in Arabic, masl, means in honey. So a flavor ban is a de facto ban on hookah. And my hookahs that I manufacture, our traditional wooden pipes, are about 3 feet tall. And I would love to see them fit that in a backpack. You know, hookah isn't the issue, as you've heard before with other callers. 90% of my customers hail from the Middle East or India, and it's a shame that someone's culture is being targeted solely because of an issue that doesn't relate to that particular product. And as an organization, we're promoting best practices. We've had 3 of the larger manufacturers get rid of any candy flavored names in their products. And, I'm for reasonable, responsible regulations. I want to push a lot of my effort into best practices amongst retailers. I support a strong TRL. I support reasonable distancing and regulation. What I don't support is, with the swipe of a pen, people who have sold legal businesses for hundreds of years will lose their entire income. Many of these people are personal guarantors on their leases. They have back rent from the shutdown from last year. Everybody's in a very tight spot, and this just is going to push people over the edge. And I urge that my ask is to follow SB 793. It seems to be that a lot of municipalities this year are going that way. It seems that San Jose may be leaning towards SB 793 language, Elk Grove, Long Beach, and we have exemptions for hookah in other cities as well. Burbank, San Diego County, Irvine, Ventura. It's something that if we get the education out there, I'm sure that people reasonable enough can understand that we are not the issue at hand. And I make myself available to you guys in any way, shape, or form that you need. Thank you so much for your time.
Thank you. Thank you very much for your input. Let me just check the Q&A box. We have Vanessa who has raised her hand. So Vanessa, you should be able to unmute yourself.
Hello guys, can you hear me?
Yes.
Hi, my name is Vanessa. Thank you for your time and for hosting this meeting. I just wanted to start off saying that I'm so happy that the state of California was able to get enough signatures to allow California voters to vote on SB 793. I think that it's a great example if the state of California wanted to try to push something like this without taking into consideration the voters' voice, that we were able to combat that. And I think it's a good example that if California wasn't able to do it, I don't believe that the city should be able to take this matter into their hands as well. I think this should be something that we wait for the state for, just to exercise our rights as voters, especially since the voters will be 18 and over, who this will be greatly affecting. It'll be affecting people who would like to purchase tobacco, and the retailers and families who have spent their life savings creating these businesses to sell a perfectly legal product that is approved by the FDA and is sold throughout the country. With that, I think the city of Santa Clara should take advantage of the fact that the state has dedicated so much time and resources to creating SB 793, and instead the city should take that opportunity to refocus their own time and resources towards education. Education is huge, and it's really where most youth spend all their day. They're spending all day in the classroom, and that's where we really need to tackle this issue. Taking away things historically has not worked, right? Like the prohibition with alcohol, that made things worse. In fact, teen pregnancies, 80 to 90% of teen pregnancies were from kids who never had a formal education on sex, whether it was at school or with their parents. And parents, again, this is a responsibility of raising a human, of raising someone who's going to one day be in the same seats that you guys are sitting in now. Parents need to have these conversations with their children. My mom's always done a really good job of teaching me right from wrong. Even like movies, right? We have movies that are rated R, PG-13, and parents need to teach their kids, like, yeah, kids might be able to access this movie online, but parents need to be the storefront, the main front of that.
Vanessa?
Yes.
We'll just ask you to say your last comments, as we have other folks who want to also.
Perfect. Thank you. Flavors aren't made to entice new users, but they're there to satisfy their existing customers. Thank you.
Thank you very much. Next up with their hand raised, we have K Street Consulting, LLC. And you should be able to unmute yourself now. Looks like they dropped off. Okay. We have a question. Why does education, quote unquote, education not hold a candle to addiction? Let me see if there's anyone else with their, so again, if you'd like to speak, raise your hand on the Zoom feature. If you are on the phone, which I don't believe anyone right now is joining us via phone, you may press *9 to raise your hand. Okay, it looks like we have 3 more. So we have MJ up next. You should be allowed to unmute yourself now.
Hello, good morning.
Thank you. I just want to remind everyone to please be mindful of time as you share your comments. We are coming to the last 10 minutes of the meeting and have more folks that want to speak. Thank you. Go ahead.
Hello.
Yeah, we could hear you. Go ahead.
Great. Well, my name is Michael. I'm a local Santa Clara retailer. And first of all, thank you very much for the opportunity to speak and to give my opinion and voice my concerns. Truly appreciate it. So, to get right to the point, if this is passed, this will affect my business tremendously to the point where I possibly will have to close my doors. And what I can say is I do, and my staff, myself, we do our due diligence every day, make sure that we enforce all the regulations put in front of us. We abide by all the restrictions and rules of per our license agreement, and make sure that nobody under the age of 21 is coming into the store, much less purchasing anything that can be harmful to them. So what I would like to say and ask is please, for this to be considered, to go to a state vote and allow the people to actually vote on this matter, and then see where it goes from there. Because again, if this is enforced, a city ban, it will affect my business to the point of potentially closing the doors. So again, thank you for the opportunity to speak, and I appreciate all the work that you're doing.
Thank you very much. We appreciate everyone joining and voicing their input through this community engagement process. Up next, we have MJ with their hand raised. So MJ, you should, MJ, I believe you spoke already, unless it's somebody different. Can you clarify? You should be able to unmute yourself. Okay, I'm not hearing anything. So I have Nam Nguyen, whose hand is raised. So you should be able to unmute yourself now.
Thank you, the City of Santa Clara, for listening. I just want to start off. The age for vaping now is 21. So technically, these minors in possession of any vape products should be illegal. But there is no penalties for these kids. So without any penalties for these kids, you think these kids are going to stop vaping? Instead, what you're doing is you're hurting the small businesses that are trying to sell and do their diligent jobs of IDing every customer that does come in underneath 30. All the retail store owners that I do know take pride in IDing every single customers and turning down every single kids that do walk into the stores. We shouldn't punish the retailers for doing their, once again, diligent job. The FDA is testing the juices for safety, as well as candy names and cartoon pictures on the packaging. So the FDA is doing some kind of things to test, and get the candy names and pictures off of all the packaging for vaping as well. All I ask is please let the SB 793 for the state to decide what we should do, and that should be left up to the state. For if you do ban it in the cities, a lot of customers are going to jump over to the next city. I personally myself have a business, and I have people coming down from San Francisco, even Santa Cruz, coming all the way down to my stores, and that's an hour away. And these older customers are willing to take that drive. So if you have a ban in Santa Clara or anywhere around here, you're just going to have our customers drive somewhere else. So you're going to lose off of tax revenue, and basically you're going to cripple our business here. We need to do more enforcement, like secret shoppers, and any penalties that are for the stores. Let's say a 3 strikes law, you should take away their license. We need to get rid of these bad apples selling to these kids and not penalize the stores that are doing their job.
Thank you for your comments.
You're welcome. Thank you for having me.
Thank you. And K Street Consulting, you have your hand raised. So you should be able to unmute yourself now, and I want to be mindful of time. It's 11:52. Want to allow for others to also ask questions before we conclude the meeting.
Sure, thank you.
Thank you.
My name's Afrak Vargas, and the unmute button did pop up, so I hit it. So we're working well technologically. Thank you very much. My name's Afrak Vargas. I'm the lobbyist for the state of California for the National Hookah Community Association. I wanted to echo the sentiments of my 2 other colleagues and members of our organization, but not to be repetitive. Just wanted to point out for your staff report that we worked with over 50 legislators, meeting with them and their staff personally before the pandemic era, of course, and even during via Zoom. We met with legislators that were co-authors, supporters of the bill, educating them about hookah and its inclusion in this flavor ban, and they were confused. They didn't know about it. We worked with the California Medical Association, Tobacco Free Kids, many of those other supporters and sponsors of this legislation, and we sat down with them for literally hundreds of hours working on amendments, working on language, and also educating them about the cultural and traditional significance of hookah and the importance, and they understood it and they got it, and thus the amendments that you see before you. Today is the last day for the signature gathering proponents to put SB 793 on the ballot. Within the next few weeks, well before you guys can finish your process and the city finishes its process on this issue, we're going to know if this is on the recall election, because by then we'll know if the recall election is qualified. We'll also know that this 793 will be eligible for this election this November. So you'll be able to potentially put a little bit of a pause on some of your work, I believe, much like a couple of the previous speakers have spoken, to see where this is, because it'll likely change everything with regards to this issue. So thank you very much.
Thank you. And looks like we have one more individual who would like to speak. It'll be our last question for today's community meeting. So Ahmad, you should be able to unmute yourself.
Thank you. Thank you, Hitler. Thank you, Leslie. My name is Ahmad Abdel Kader. I am originally Egyptian, naturalized citizen, and I was listening in, and I agree. I also brought in my tradition to this country. I practice it in the privacy of my home. I smoke hookah in my balcony, away from my kids, whenever I can, once or twice a week. I buy my tobacco, my shisha tobacco, from the retailers. As you've probably heard before, hookah tobacco comes only flavored. So if we ban this, flavor ban and including hookah in it, you are destroying the tradition that we've enjoyed for thousands of years. Me, my family, my friends. Again, this is not something that the youth these days are accustomed to. they don't want to spend their time smoking a hookah when they can have a vape, hide it in their pockets, in their back pockets, and smoke it whenever they can. So vaping is a big problem. I ask you to be very stern about the vaping pandemic, but quality cigars and hookah are not the problem with youth these days. So let's separate them if possible and combat youth and underage smoking, which is the biggest threat to our community. Thank you.
Thank you for your comments.
Thank you.
So we have two more hands raised. I want to note that it's 11:56. So if you could please keep your question or comments brief so that we may have time to answer. So Claudia Martinez, you should be able to unmute yourself.
Yes, I'm here.
Yes,
Can you
we
hear
can
me?
hear you. Yes.
I'll make it quick. I just wanted to say I'm a resident in the community and a parent of two young teen girls. I also smoked for close to 15 years and then switched over to vape, which, I understand isn't exactly healthy, but it is a lot better than smoking cigarettes. And it's helped me not only to have a little bit of a healthier alternative and also actually smoke, or I should say vape, way less than I used to smoke cigarettes. Just wanted to mention that I am very strict with my kids, and I, educate them about the risks of smoking and, definitely prohibit it. And they, either way, have no desire to smoke, think it's gross. And so I do think that more responsibility needs to be placed on our parents, our community, our schools to educate the kids so that they won't be entering these stores and buying, these products. I'm not, just because I smoke, it doesn't mean I am for minors smoking as well. It just happens to be something that we do as adults. But yeah, I'll wrap it up. Thank you for your time.
Thank you. Thank you. And we have one more question. This will be the last question we take for today's meeting. We have Michael. If you could please keep your question or comments brief so that we may address. Thank you. So you should be able to unmute yourself. Michael?
Hi, can you hear me?
Yes, we can hear you.
Perfect. Yeah, so what this ban is doing is it's going to really hurt businesses in the Santa Clara area. It's not going to specifically stop young people or kids from smoking. I understand we are trying to protect our youth, but unfortunately the ban does not work. And we've seen that in other cities and counties in California. The only way that it's going to fully work is if we get a complete ban in all of California. Kids, young people, everybody, they're just going to go to different cities and get the product. And it's really just going to hurt businesses who are doing the responsible thing and only, selling to people that are over 21. We need to have education for the kids. We need to have, secret shoppers go out there and, like they said previously, get those bad apples, because we're only hurting the responsible parties that have had these businesses for multiple years. And these kids are just going to get it. They're going to get it online still. They're going to get it from different cities, out of state. And now they're going to get it from drug dealers. There's going to be a big black market now if, they can't get it from, if people can't get it from regulated stores for over 21. You're going to have people outside of regular stores selling not only vapes, but now kids are going to have access to other harmful drugs that these dealers are going to be selling. It's just going to be a huge black market. And we should really just get together, find a better way, and wait for the state so that we can all continue together and make it safer for our kids. Thank you very much.
Thank you, Michael. That concludes our question and answer portion of this meeting. I just want to say thank you to everybody for joining today. We did have approximately 20 participants. There are there's one more community meeting next week and also a business forum. And as Leslie mentioned, Leslie, maybe we could put up the slide of how folks could give their input in other ways as well through our survey on our website. Yep. So again, if you haven't already done so, we encourage you to take the survey, which closes at March 31st. For more information and updates as we go through this process, you may visit santaclaraca.gov/smoke-free Santa Clara. Again, thank you very much for your input. We will be able to take this as part of our information gathering from the community engagement process. So thank you everybody for your time, and we will now conclude the meeting.